and having a nicer summer than worrying about the needle. So yes, it wasn't a worry, and I know it is a worry to a lot of people. And I say to them that I do have acupuncture, and they say, well, how do you get over the needles? But it's not like an injection needle at all. So yes, it's sort of irrelevant to me compared to the benefits of it.
That's a really good news story there. I mean, what does it actually feel like? I mean, it must be a slightly peculiar sensation when you sort of turn around and you can see these needles poking out of you. Do you feel like a pincushion?
I must admit, I don't always look. No, and it's a very, it's quite a relaxing experience as well. And it's not, I don't find it particularly painful. I mean, obviously there are more areas that are more sensitive, but no, I don't. I feel quite comfortable and relaxed.
And Claire, thank you very much for telling your story this morning, taking the time to get in contact. Really great to hear from her. I mean, something like that, Richard, would you have to have that, on a yearly basis, every time the hay fever flared up, or would that be one treatment and it's gone?
No, it's something that you do have to top up. We recommend that people come along before the hay fever season starts, to be honest, and then perhaps you can have a summer clear of hay fever altogether. The typical thing would be for somebody to come along and have perhaps a handful of 5 or 6 treatments on a weekly basis, and then that may be sufficient if it's only recently started, or if they've got other issues, then it may be useful for them to go on having perhaps monthly treatment or something like that to look after those other conditions.
And Claire said, it's quite relaxing. It's hard to associate having needles put in you as being something that's relaxing.
It does seem that way until you try it, I agree. But really the sensation of acupuncture is pretty mild. If you want to know what it feels like, if you tug a hair out of your forearm, that sensation is what it feels like to have an acupuncture needle, I should say, breaking the skin. They're incredibly fine. You'd probably get about, I should think 8 or so into the aperture of a normal hypodermic, so they're very, very skinny.
Oh, wow. That's a nice thing to be able to equate it to. Got some great text messages here as well. Thanks ever so much for getting in contact, and you can do so as well on 81333, 81333. Just make sure you start your text message with the word Faye, and that's F-A-Y-E. Now that's what Nick has done as well. Nick, thanks for getting in contact with the show. She's text to say, hi, would acupuncture help dystonia, which is a neurological movement disorder, which is in the neck?
Okay, I have to say I've never treated it, and the nature of being an acupuncturist is you often come up against things that you've never treated before, and it's a sort of suck it and see basis. One of the strange things about acupuncture is, as much as treating the condition, you're treating the person. So it may be that there's an underlying problem that Nikki could be helped with that wasn't specifically about the condition she's talking about. So it may relieve it in that sense. It may be that if she were more relaxed and feeling better, in herself, then she might get less episodes.
Okay, and I guess in many cases it would be... would you be happy for me to say, you might want to start with the GP first? Or...
Oh, yes.
Because there will be some things,
It really does depend on the condition. I think certainly when, an acupuncturist is saying to you, well, I don't know if we're going to be able to help, it might be sensible to find out if there is somebody that can say clearly, yes, I can help,
Brilliant. Richard, thank you very much. Now, if you'd like to put any questions to Richard, he's our doctor in the house this morning, here with us until 11 o'clock. Please do so. You can text 81333, start the text message with the word Faye, and that's F-A-Y-E. Of course, you can pick up the phone, give us a ring, 0845 900 5949. That's 0845 900 5949. Of course, you can always drop me a line, faye.dicker@bbc.co.uk.
BBC Radio Bristol.
All this week, join me, Peter Rowell, as I'll be looking after the morning show.
I love it down here.
So there is a sense of community where you are.
Well, I found it since I've been down.
Jackson and The Way You Make Me Feel, just gone 10 to 11. It's BBC Radio Bristol that you're listening to. Faye Dicker here with you till midday. Joined in the studio this morning by my doctor in the house, acupuncturist Richard Gibbons. And I've got some callers on the line now. Let's see if we can get to them. Marion in Filton. Now, Marion, I understand that you've recently received treatment at Frenchy. What's the question that you'd like to ask Richard this morning?
Well, good morning to you. The question I would like to ask is, I was referred originally by my GP to Frenchy Hospital because they do have an acupuncturist clinic there, pain clinic there. And I saw the consultant and went through all the various tests for her, and they decided I was the right candidate to receive acupuncture. And I had a course of 5 sessions, which did help. It doesn't get rid of the pain, but it makes life a lot easier, I find. And then after that, they said, well, I could go on having what they called top-ups. And it was another one session every 8 weeks. Well, now the pressure of work there is so great that they've had to put it back to once every 12 to 13 weeks. And I want to find a really good acupuncturist who can give me some top-ups in between my visits to Frenchy. Is that possible? I mean, would you be able to do it if I got in touch with you?
Yeah, of course, I'd be happy to do it. Certainly, having treatment every 12 or 13 weeks doesn't sound like it's going to be enough in most cases. You know, normally when people have been referred to the pain clinic, it's because they've got some real ongoing, long-standing pain.
Yes.
It's difficult to cope with.
Yes, that's right. Well, I do feel that excuse me, once every 8 to or no 12 weeks is not sufficient. I won't say it's not worth going, because it is, and I do get some relief for a little while, but it's not long-lasting.
Marion, can I just ask you, how do you find acupuncture? I mean, how did it actually help you?
Pardon?
How did acupuncture help you?
Well, it eased the pain tremendously for quite a long time, and when I say a long time, that was a couple of weeks or so, and it made life more bearable, whereas I have to walk around and endure this pain constantly. It wasn't there constantly anymore.
So it was a great relief then, Marion.
It was quite a lot of relief. I'm afraid to sing its praises too much. I'm sort of quietly cautious about it.
You know, the thing is about acupuncture, Marion, is it's a cumulative treatment. So
yes.
as you have more, you get more effect from it. So
yes.
Each treatment builds on the previous recent one.
Yes, that's what I was hoping you'd say.
Yeah, so certainly you should expect some good results from having more regular acupuncture, whether it's with me or with somebody else.
Marion, thank you very much for your time this morning. We will see if we can pass on some contact details for you, and hopefully you can get some top-ups, as you've been saying.
Yeah. Would I be able to have a phone number for Richard to speak to him off air about...
yeah, we'll make sure that we'll get our producer. Yeah, we'll get our producer on the case. Don't you worry at all, Marion.
You can get someone to deal with me.
Yeah, we will.
Thank you ever so much.
Don't you worry. It's a pleasure.
Wonderful. Thank you so much.
There we are, Marion. There. Thank you very much indeed, Marion. Great to hear from you. We've got another call as well. We've got a few to be squeezing in this morning. This time we're going to be hearing now from Barry in Kingswood. Good morning, Barry.
Good morning.
I understand that it's your wife who's suffering at the moment.
Yes, she's been suffering very badly for sort of sickness and nausea for about 7 to 8 months now. We've been under the doctor for such a long time with medication, and we don't really know whether this is an anxiety state or whether it's some underlying state. Nobody can sort of tell us, and we're at our wits' end, really, and we're just trying to find out if acupuncture could actually help in this case, you know?
Morning, Barry.
Good morning.
Good morning. I would wholeheartedly recommend acupuncture in a case like this. Acupuncture is tremendous at controlling nausea. We use it in morning sickness, and it gets used with cancer patients who are suffering with nausea from chemotherapy. And it is also very good at dealing with anxiety. So if the underlying cause were anxiety, you would get a double effect there, and she would be feeling better in herself, regardless of the nausea.
Oh, right, yeah. So we can go ahead with, it would be a good idea to try acupuncture, would it?
Yeah, it would be a very good idea.
Yeah. I mean, the medication doesn't seem to do anything. We bring him out going down the lines of psychiatry, or physio-psychiatry, the counselling thing, but we don't know what to do, really. So we were wondering if the acupuncture would actually help, in fact,
I'm sure it would. I was just saying to Faye, there's an element of counselling sometimes in acupuncture. We spend, we allow close to an hour for an appointment, which gives good opportunity to be talking and talking in a counselling manner.
Mm-hmm.
And then plenty of time to treat as well.
Oh, good.
So
you think it would be very beneficial then, really?
I would recommend it.
Oh, can we actually get in touch with you later?
By all means.
Yes.
And I can also give you names of of more local acupuncturists if you want to.
Oh,
Barry, if you hang on the phone, we've got a few texts we'd like to squeeze in as well.
Okay.
And I know our producer Lou will help you out, but thank you very much.
Thank you very much.
I do hope that your wife, she feels better very soon. Some texts as well this morning. Thanks ever so much for these. One from Jo in Redland, and she said, I'm about to go through fertility treatment. I've been told that acupuncture can help increase the chances of success. Is this correct?
It seems to be. There's plenty of evidence suggesting that it is. A couple of years ago, the Bristol Centre for Reproductive Medicine, which is one of the best centres in the country, was talking to me about working there to actually offer acupuncture on site. In the end, it didn't happen because, unfortunately, the funds were the problem. But that was their intention.
Okay, we've got another one as well from Maggie. Say, I believe this is a bursa and hip pain. How many treatments should I need?
Initially, you would probably need a few weekly appointments, and then it would be spread out to accommodate what your need, which might be monthly, might be 6 weekly.
Okay, so it's an initial consultation, and then sort of, as we were hearing earlier, like a top-up thing almost.
That's right.
Yeah. Another text this morning, this is from Penny, and thanks ever so much for getting in contact with the show this morning, Penny. She wants to ask if acupuncture can treat aches and pains in the shoulders, the left one in particular. I'm a woman, 48, perimenopause started last year. Thank you, and that's from Penny.
Yes, we see lots of people with joint pains all around the body. Chronic pain is probably what acupuncture is best known for treating in the West, because that's what science understands about it.
Okay, well, listen, it's been lovely speaking to you this morning, Richard. Lots and lots to fit in. Before you dash off, I know that is it a natural health clinic that you work at as well?
That's right. It's Bristol Natural Health Service, which is a fantastic clinic and resource for Bristol, really, on the Gloucester Road, just by the Ashley Down Road junction. We've got about 20 different practitioners who offer all sorts of marvellous treatments and are really committed. And the telephone number, if I may give it, is Bristol 944 4448.
Brilliant. Well, Richard, thank you very much for your time this morning. It's been lovely having you in the studio. And thanks for all the guests who have phoned in as well and put our questions to Richard. And if you didn't quite get down those numbers, we will make sure we give them out shortly. First of all, music from Tom.